very early or extubation very early, but also using capnography to determine return to spontaneous circulation or patients that are imminent cardiogenic shock or failure, monitoring with the CO2 for that.
You know, it's interesting, in the pre-hospital setting and in anesthesia, capnography's been around for a while. But what do you think it is that makes nurses so uncomfortable with using this tool in some cases?
I think it's a unfamiliarity. It's not been in the nurse's toolbox for very long. It's a relatively new technology to be widespread in hospitals. And you're right, paramedics are very comfortable with it, the operating room are very comfortable with it, but it's time to now expand. The AHA guidelines that came out in 2010 are really requiring the use widespread, but there's just an unfamiliarity with it, and there's always fear in the unknown. But I see that after the presentations, the light bulbs go off and they say, oh, it's really not that complex of an issue. And if I could read an EKG, I could certainly read capnography readings and use it in my day-to-day practice. And that's what I'm empowering nurses to do, is go back to their facilities and really implement this for patient safety.
And that's the key, is really to bring it into everyday practice. You can learn so many things at these events, but to be able to take them back and apply them really is what makes some of the education here special.
Oh, absolutely. And based on the feedback that I've been getting from these talks, a lot of nurses are now saying, okay, I'm familiar with capnography. Give me the tools that I can bring back. And that's going to be my next talk, hopefully next year at the conference, is empowering nurses with the evidence-based practice, the evidence guidelines, some legal cases that have shown that one patient death can buy capnography monitors for an entire hospital, and to equip them with tools that they can just very easily go home with and utilize for their own use in getting capnography on the floors.
Excellent. Well, Sue, I'm hoping to have you back on the show because I know you're an author as well, and
Yes.
we'll have you back in a future segment, but I definitely want to